do you do fat transfer to breasts? If so, do changed as well as in the skin? Yes, we do fat transfer to the breast. Fat transfer to the breast is always subtle, so it's something we really have to talk to you about, because I think people come thinking it's the great, best thing ever, and it's fantastic, and you take some fat out of your buttocks or your thigh or your tummy and inject it into your breasts. Who wouldn't do that? That would be fantastic. We must be doing it all the time. We hardly ever do it, to be honest with you, Ella. And that is because it's always really subtle, the results of fat grafting to the breast, particularly when you've got to do both breasts. When you've got to do one breast, so if you had a breast asymmetry, or if you had a dent or a ripple of an implant or something like that, then it's really good. It gives an extra bit of subtle layer of cover. But actually, I don't know if you're talking about like cosmetic breast augmentation, there are people who do it and report good results, but in our hands, it's quite subtle. It's not a huge volume. It's not a cup size. It's less than a cup size it would be, and it's subtle. But it's permanent, and it's a great option if you are very slim and you don't want implants, particularly if you had a problem with implants, or there's a reason you particularly don't want to have implants. But it is subtle, and it is quite expensive. It's almost as expensive as implants, and because it's so subtle, you often have to repeat it. So it can work out to be a much more expensive way of doing it. But once it's there, and then it's your fat, it gets bigger and smaller as you change weight. So it is a good thing, but it is limitations, and it's really something we need to talk about in the clinic, in person, to see whether it's right to you, and to make sure your expectations are matched with what we can achieve, so you're not unhappy, because that's the main thing. We don't want to say, yeah, have some fat, it'd be brilliant, fantastic, take it out of your thighs and put it in your breast and everyone's happy, and then you're like, it's not much of a difference, and I paid thousands of pounds for this. So we don't want that to be stable. Here we go. I'm referring to using, this is Ella again, fat transfer instead of implants. That's why. What is the most you can transfer per breast? I'll give you an idea of figures, Ella, but it does depend on the size of the breast, which is what we call the recipient site, and it depends on the donor site. It depends on how much fat you've got. And ideally, you want someone with a lot of donor site, with big breasts, and a lot of recipient site, which is going to be big breasts, and a lot of donor site, so a lot of sort of fat around their body. But as a general rule, people having breast augmentation are not that. You're unlikely to get someone with a big breasts who wants fat grafting, but to have breast augmentation, because they wouldn't need it if they had big breasts. So people wanting breast augmentation are usually quite slim with small breasts. And the problem is, what you're trying to do with the fat grafting, with the fat transfer, is you're trying to put it in the skin, in the space between the skin and the breast, and also the space underneath between the breast and the muscle. So you're sort of putting it around the breast. You're trying not to get it into the breast tissue itself, and you're limited to the space you can put the fat in. And as I say, usually patients have got a small breast. That's why they need the surgery. And so you're limited places where you can put the fat, and each little piece of fat you put it in tiny little aliquots, because each little injection has to be surrounded by healthy vascularized fat. If it's not surrounded by healthy vascularized fat, you try and inject a big glob of fat in, the bit around the outside will be surrounded by healthy vascularized fat, so that'll get a blood supply, but the bit in the middle won't get a blood supply, and it'll die, and you'll form a little cyst, or you'll form fat necrosis, a little hard lump. So you have to inject it in tiny little aliquots and have normal, natural, healthy fat surrounding each little aliquot that you inject. That's why it takes so long, and that's why it's limited to how much you can put in. Also, the donor sites are important. As I say, often people having fat transfer are very slim, and they've got a limited amount of fat that you take the fat from, limited areas of fat you can take the fat from. So the donor sites are limited. So you're often limited to how much fat you can harvest and how the space that you can put it in. Once you put it in once, and you have a slightly bigger breast, then you can put more in second time. So as well as, like, it does often have to be repeated. So the sort of volume, the most you can transfer per breast. I mean, the real experience that I've got in breast fat grafting is in breast reconstruction. So people have had a cancer and have reconstructed a breast, and they often do have good sites, because they've often got some good sort of subcutaneous covering, and you're always just going on one breast. So you can put, or I have put, 250 to 70 cc's into a breast in one go, which is big cc implant, but that's not common, you know. And if you're splitting it between two, then you're doing a bilateral. The common sort of volume is less than 100 mils per breast. 40, 50, 60, 80 mils per breast, maybe 100. If you're lucky, something like 120, that would be a lot per breast. Now you've got to remember a cup size. People say, broadly speaking, it's about 150 cc's. So that's less than a cup size, maybe even half a cup size. And you're paying the same as if you had breast augmentations, or almost the same as you're having breast augmentation, where you can easily get a 270 cc implant off the shelf and predictably say, I'm going to make your breast 270 cc's bigger, or 300 cc's or 400 cc's. You know, you can do that with an implant. But with fat grafting, you are limited with the volume. So you have to be aware that it is often subtle, and it's all about patient expectation.